Hey, this is Mrs. Reichelt, and we're still in Anatomy and Physiology. We're in Chapter 1, but this video is really going to focus on homeostasis. If you remember what homeostasis is from biology, that is fantastic. I'm so happy to hear that because anatomy is homeostasis rather, is a very essential part of anatomy. So, homeostasis is the maintenance of a stable internal environment. Okay, your body is in a constant state of dynamic equilibrium. What that means, dynamic, is you're constantly changing a little bit. So if you remember learning about the cell and the phospholipid bilayer, we talked about it was in a dynamic state of equilibrium. Dynamic just means that the phospholipid bilayer isn't just a circle that doesn't move around. Dynamic means it's constantly moving and it's constantly changing. So your body, just like the phospholipid bilayer, is in a state of dynamic equilibrium. Any type of interruption to homeostasis or an imbalance is going to cause a reaction, hopefully, from your body, which can be in the form of maybe you get a cold or a virus or a disease of some sort, and hopefully your body is going to go through a couple of steps to try to re-establish homeostasis. So let's go through each of those steps now. Go ahead and think of homeostasis, or that stable environment, as a teeter-totter. Anytime that teeter-totter changes, your body senses that change, or the change rather is going to be the stimulus. So the stimulus is going to be anything that either produces the change, or maybe your sense receptors feel, the cutaneous sense receptors are going to notice that something's itching you or something like that. So the stimulus is going to be what's first. After the stimulus, what's happening is you're going to send that message from the stimulus to a receptor. We'll go back and fill in some of these other ones a little bit later. So we have our receptor. The receptor is going to send our message to the control center. The control center is going to determine the appropriate response, and then from there it's going to send the response to an effector. Okay, from there the effector is going to make the change, or actually have the response to hopefully return your body to that homeostasis. Okay, so let's go back through here. The receptor's major job, I better write it up here. The receptor's major job is to respond to changes, okay? Those changes can be internal or they can be external. So any kind of stimuli, your receptor is going to respond to those changes. In addition, the other job of the receptor is it's always going to send that information to the control center. So sends that info to the control center, okay? Collectively, going from the stimulus all the way up to the control center, this is also called an afferent pathway. The control center is normally going to be your brain or spinal cord. The control center is going to function in determining the set point. So it determines, whoops, the set point. Set point means whatever the body considers to be normal. So for example, our normal body temperature is 98.6 degrees Fahrenheit. Okay? If your body is 100 degrees Fahrenheit, then all of a sudden the control center is going to determine that the set point should be 98.6. So it's going to then hopefully make some changes to lower that body temperature. So it determines the set point. It also is going to analyze information. Okay, it'll analyze any information that's carried through the afferent pathway, any kind of incoming stimulus, or the receptor is going to analyze information at the control system level. In addition, the control center is going to determine the appropriate response. Once the control center has the appropriate response, it's then going to come up with an output. Okay, the output is the response. It's going to go to the effector. The effector provides a mean for response. So we'll say provides a mean for the response. Okay, and then lastly, once you have here, you'll actually have your response. I guess we can go in and fill a couple of other things here. So this is going to be continued with the stimulus. So the stimulus is going to be here, or you could even say, since stimulus is here, you could say that the change is going to be here. Then the receptor is going to pick up on that. Then you're going to input information to the control center. From there, the control center is going to determine the appropriate response and send that signal as an output. The output is going to be sent to an effector. Usually it's going to be a muscle or a gland. From there, the effector muscle or gland is going to determine the response. If this is confusing, please go back through and not read through it, but watch the videos again or read through your notes or ask a lot of questions, because a lot of what we talk about in physiology is going to be when there's changes to homeostasis and what your body does in response to those. Let's see here. So just really quick, one more time. This is going to be homeostasis. If a change occurs or a stimulus, so anything maybe changes, maybe the temperature of the room changes, the stimulus is going to go directly to a receptor. If we're talking about the room's getting cold, the receptor then is going to be your skin is going to feel cold. Okay? From there, that message is going to be sent to the control center. The control center again is going to be your brain and your spinal cord. The brain and spinal cord is going to decide what action needs to be made. So in this case, if you're cold, the action that needs to be taken place is probably going to be you're going to end up shivering. So before you can shiver, the control center has to send that message to the effector. The effector organ, which is probably going to be your muscles. Your muscles are going to send the response to shiver because you're cold. So it hopefully will warm your body up. Okay, so there are a couple of feedback mechanisms. The most popular or the most common feedback mechanism is going to be negative. Negative feedback includes most of the mechanisms. Okay, most of the time when there's some sort of imbalance to homeostasis, your body is going to work to shut off or reduce the stimulus. It'll reduce the intensity or reduce the original stimulus. An example is a thermostat. And there's a picture of a thermostat in your textbook. So if negative feedback is still really confusing to you, I really recommend that you go look at your book and ask me if you have questions. The next type of feedback is less common, but you have positive feedback. Positive feedback is actually very rare in the body. What happens for positive feedback is it's going to increase the original stimulus to push that stimulus even farther past the set point. Normal positive feedback occurs in blood clotting and in childbirth. Are two really good examples of positive feedback. So the stimulus is going to increase until the baby is born, or that stimulus is going to increase until your blood actually clots. So there's two types of feedback. Negative feedback is certainly the most common one. That's when that last example where it's sort of like a teeter-totter and you're going to shut off or reduce that stimulus or that change. Positive feedback, you're going to increase that stimulus. I hope that's helpful in determining the differences between feedback systems.